My name is Romano Richard Kapinya, and today we are going to talk about shaking palsy. Shaking palsy, okay, or we call parkinsonism. Okay, Parkinsonism is a progressive disorder of the central nervous system, which is accompanied with both motor and non-motor symptoms, also known as shaking palsy, founded by Sir James Parkinson in 1817, where a person will be like you have seen. Okay. Now, basically, I'm going to deal with the cardinal signs of Parkinsonism, though there are mainly most signs like the motor and non-motor, but mainly we are going to deal with the cardinal signs of Parkinsonism. Now, if we begin, what is the etiological cause? The etiology of Parkinsonism is mainly due to the disturbance in the dopaminergic system. Now, the diagram below shows the normal physiology of the dopamine, the release of dopamine from the basal ganglia till to the body and everything. Now, if there is disturbance, then there will be Parkinsonism. This is mainly caused by genetic causes and environmental causes. There are mainly different causes cause Parkinsonism, but mainly they are genetic and environmental causes, as we are going to see ahead. Mainly, what are the classification of Parkinsonism? In a nutshell, Parkinsonism is classified into two causes, primary cause and secondary cause. And when we talk about primary classification, we are talking about idiopathic, unknown causes. We don't know what causes Parkinsonism, and it's mainly account for 78% of Parkinsonism. Now, when you're going to talk about secondary Parkinsonism, we are speaking about different Parkinsonism. There is Parkinson plus syndrome. This is where the condition mimic PD in some aspect, okay? Then is post-encephalitic Parkinsonism, where one has encephalitis, then he or she will suffer later in Parkinsonism. Then there is toxic Parkinsonism, where toxic Parkinsonism is from toxic exposure to toxin. Then we are talking drug-induced Parkinsonism. Different drugs can induce Parkinsonism. Now, basically, what we are going to talk today about the cardinal features. Whatever these Parkinsonism types and classification, but they have cardinal features that if a patient comes and he has these 4 features or 3 features, then we diagnose that patient with Parkinsonism, symptomatic diagnosis. What are these 4? These 4 are rigidity, bradykinesia, tremor, and postural instability. But before I talk about these 4, let's speak about other features like non-motor and motor. We can speak about irritable bladder, excessive salivation, mood disorders like person is happy, sad, and everything, confusion, constipation, dementia in some cases. Okay, these are the non-motor symptoms. But today we are going to deal with only these 4. Okay, let's begin. Rigidity. Rigidity is the increased resistance to passive motion. Like you can say, there is resistance to passive motion. I want to take this one from here, but then there will be a resistance to my motion. Okay, the hand will be rigidity. Now there are 2 types of rigidity. There is cogwheel and reed pipe. When we say cogwheel, there is jack latchet resistance to passive motion. The muscle is tense and relaxed. And when we talk about reed pipe, there is sustained. Different from cogwheel is that the one is sustained resistance to passive motion. Okay, let's talk about bradykinesia. Kinesia, as we know, kinesia is movement. You can see that the old man is walking. Now that is movement. Now when the movement is slow, that is bradykinesia. The slowness of the movement, that is the cardinal features of PD. Okay, then we are going to talk about tremor. When I do my hand like this is tremor. Okay, we're talking about tremor. The hand is shaking. That's why we're calling it shaking palsy. Yeah? Now, if there is oscillatory movement of the part of the body, it can be a part, a hand, an arm, or the body, all of it has tremor. Now, that is Parkinsonism. Those are the 4 cardinal features of Parkinsonism. Now, as we know, Parkinson is mostly occurs in adults. Okay, mostly, like you can say, the epidemiological of it. It mainly affected about 45 to 60 and above. It's mainly seen in 60, and it's mainly in old people. Mostly affect girls more than boys. Those are the risk factors for Parkinsonism, but mainly this thing can be observed in mostly older adults. Okay, as you remember, cardinal features, we talked about tremor, bradykinesia, rigidity. Those are the 4 cardinal features of Parkinsonism. Last is postural instability, abnormal posture. Okay, you can have forward bended head posture. You can have lateral posture. The posture is unstable. A person cannot sustain an effective posture, normal well posture. That a person cannot keep a center of mass within the base of support. The patient is okay. That's there's a lot of way of explaining it, but that is postural instability abnormality. One is not balanced, and these things you can even, they go to affect even the gait of the person. That we call, those are the four cardinal features of Parkinsonism. Hope you have understood the four cardinal features of Parkinsonism. Now, management. In a nutshell, we are going to talk about the management of Parkinsonism. Obviously, the drug of choice is levodopa. Okay, levodopa, it's dopamine agonist, mimic the dopamine level, so it will act as dopamine in the body of the patient. Now we are going to talk about physical therapy. As we know, exercise or regular exercise training, postural training, balancing, like vestibular balls and everything. Those are the examples of the management of Parkinson, but we are not dealing in the management, so we are mainly dealing with those four cardinal features. As I can sum up, okay, the speech therapy, occupational therapy, dream stimulation, and psychological support. As I said before, this slide we only deal with the four cardinal features of Parkinsonism. The first feature is rigidity, where there is cogwheel and lead pipe. Then we have postural instability, where mainly a person has forward-headed posture. Okay, then we can talk about. Then we talked about bradykinesia, slowness of movement. Those are the cardinal features of Parkinson, and mainly we can diagnose it through these four features of Parkinsonism.